Welcome to another episode of Sketchy Ursta. Today we'll be looking at topical agents. Our first drug today is azelaic acid, represented by the red witch. Azelaic acid treats propionic bacterium acnes as well as staph epidermidis, represented by the staph. It reduces inflammation due to free radical scavenging effects and has keratolytic effects, represented by our keratolytic snake. We use it to treat acne. Our next drug is benzoyl peroxide, represented by a Dr. Benzoni wearing a miner's hat. The miner's hat represents that benzoyl peroxide is the derivative of coal tar and is well absorbed through the stratum corneum. Does not lead to resistance and has keratolytic activity, represented by the keratolytic snake. We use benzoyl peroxide to treat acne in combination with erythromycin, clindamycin, and adaptogene. Our next drug represents calcipotriene, which is represented here by the guy from California with his bottle of Sunny D. Calcipotriene is a vitamin D analog that inhibits the proliferation of keratinocytes. And forgot the snake, but here's our keratolytic snake, treating severe to moderate psoriasis. Our next group of drugs are the retinoids, and the retinoids have the word retinoin in them. Retinoin, or retin. And just remember the red retinas of this pregnant lady, because retinoids are teratogenic and cause birth defects in pregnant women. The only exception to the retin word is adaptogene, which is represented by her A shirt that says adapt. There's a sign on the top that says act now 3 free, and that represents the drug acitretin, which causes birth defects, so you should avoid pregnancy for 3 years. Use acitretin to treat psoriasis. Our next drugs are the photochemical agents, represented by the suffix salin, methoxylin and trioxylin. Remember this brown boat that is sailing and has psoriasis sales and eczema sales as well. Adverse effects are similar to those with severe sunburn, including nausea, blistering, painful erythema, photoaging, and non-melanoma skin cancers. Our final group of agents include the corticosteroids. For these ones, they treat psoriasis and atopic dermatitis, which is eczema, and they have varying strengths, which I have learned using this mnemonic. Hang tight, don't cancel boards, because you guys can do it. H stands for hydrocortisone, T for tricynolone, D for difluorazone, C for clobetasol, and B for betamethasone, which has super high potency, these two. Oh, lastly, you will notice that Dr. Benzoni has the T tie, which represents the drug T-retinoin. You should avoid using benzoyl peroxide with T-retinoin. which is a retinoid. Thank you.